Welcome back. As we mentioned earlier in the show, DHHR is beginning a new way to provide background checks for long-term care workers through a program called West Virginia Cares. So, how will this affect nursing facilities, assisted living communities, and others caring for this population in West Virginia? Joining me to talk about that is Patrick Kelly, CEO of the West Virginia Healthcare Association. Hi, Pat. Thank you for being here.
Thank you.
First, can we just talk a little bit about the impact of West Virginia Cares, what you believe is critically important for our viewers to know?
Well, you know, as you said in the first segment, we've always done background checks, but we haven't always done federal background checks. Only people who've lived out of state or worked out of state would get the federal background check. Under West Virginia Cares, everyone who works in the nursing home is going to have that. That's going to be great because we don't want to hire anybody who would be a threat or cause any of the residents to be in jeopardy. So that's a real plus. The other thing that West Virginia Care does is because it's computerized, it routinely searches records to make sure that if anybody after they've been hired commits a crime, we'll know about it right away. And that's great.
That's an important point that we didn't bring up in our earlier segment. I think that, you know, the recognition, there's always a concern that no one's going to voluntarily come in and say, oh, by the way, you know, I committed a crime last night. And sometimes, you know, based on just the system itself, it could be a while before anyone would be made aware.
Well, and when you think about it, West Virginia has so many big cities on borders that someone could go across to Ohio or Virginia, and you might not know about the crime, you know, but because of this computerized background check, we'll know about it very quickly.
That's great. Added layer of protection for our seniors. It's important. You know, I know that there are, you know, many West Virginians, obviously, that want to stay in their homes as well. What can they do to protect themselves? You know, I think we do a great job in facilities because we know when we have people entering homes, but what can just the regular citizen out there do to protect themselves?
You've got to be careful about who you let into your home. You know, a lot of times what happens is that somebody will go into the hospital and they come out and all of a sudden they need someone to help them. And you're in a scramble to find somebody to take care of them, and you don't do the kind of background check you should. Now, obviously, as an individual can't run the fingerprint checks like a healthcare facility, but you really need to check the references because you don't want someone to go in there and basically scam that person. And it starts off in a very gradual way. They build trust with the individuals, and then they'll remark about a nice piece of jewelry or something and get them to the point where they say, why don't you take that because you've been so good to me and that. And there have been situations where an older person gets wiped out by their caregiver and then the caregiver leaves. So you've got to be real careful.
And I think that's a very important point for everyone to realize. When, you know, when we're checking references, you want to make sure that those references are people that have actually cared for an individual and that they're not also scamming it on the references and who they're listing. That happens as well, I would think.
Absolutely, it does. You know, the people who unfortunately are scammers are really good. They call them con men because they build your confidence up and then they take advantage of you. So you got to be really careful.
Now, I know there are many people in West Virginia that do need help, you know, whether they're looking for, you know, another place to live, and, you know, a nursing home, which is a great option for them if they need those services. But a lot of people just don't even know where to begin. So how do they start the process? What is it that they can do to sort of research and find out what options are available to them?
You know, I have a mother who's in her late 80s, and actually she's 90 now, but when I started this project of wvseniorcare.com, I was dealing with some of these issues. My mom wanted to remain at home, and we were trying to figure out how can we make that happen. And the resources were hard to find, so we created a website called wvseniorcare.com, and on that you can go in and find the answers to these questions. And we set it up real simple because I was thinking, I'm the guy looking, how would I know? And one is, what are all the services available for me in home? And there's a box on that, and you can look at all the things from Meals on Wheels to, you know, home health agencies will come in. Then the next box is, what are all the healthcare facility options that I have available, and list everything from hospice houses to nursing homes, assisted living. And then in the final box we had hospitals and, pharmacies and medical suppliers. So if you need durable medical equipment like a bed brought in or something like that. And the pharmacy section talks about programs that are available to get free drugs if you qualify.
Well, I mean, I think this is awesome. I mean, I don't think enough people know about this website, because I know I get questions, you know, as a healthcare provider, and in my particular position as a secretary, I get questions about this all the time. And this is just a great resource for people, simple to use. And I appreciate the fact that it's out there and that, you know, someone has created this. But I do think sometimes people have that extra question. So, you know, who do you talk to at you know, if you're interested, as an example, in nursing home, or if you're interested in assisted living, or you're interested in some type of personal care, how do they get the information? I mean, you know, who do you call, and, you know, how do you talk about this? What's important, I think, for people to ask? What questions are important?
I think that you've got to start with your family physician, because they know you the best. They know what your limitations are, what level of care. You know, one of the things that's complicated about the healthcare system is you've got to know what level of care you need to know what facilities are available. Same thing with the services. So talking to your physician, they can give you great guidance as to kind of where you fall in and what would be your options available.
And that's a great place to start, with your doctor, because they know you the best. What sort of concerns do you think that families have? I mean, what are the things that they bring forth when they're talking about, you know, what's the next step? You know, what do I need? What kind of concerns do you think that you hear most from people?
You know, people are concerned about safety. They're concerned about the cost of the services that they're going to receive. They're concerned about whether they can receive them in home or whether they have to move to a healthcare facility. You know, when these things come up, it's usually like after a hospital stay, and everybody's in a little bit of a panic as it is. So it's a very difficult time. One of the things on the senior care website is it gives you a list of questions to ask those healthcare providers that you're interviewing, because you might not think of all the different issues, and that's a good place to start.
And I think that's, you know, really a great way to end, to think about, you know, okay, we've got a website, you can go to it to get more information, and know that, you know, there's so many great resources out there and so many people that do great work. So I thank you for what you do, and for all of the members of the association, what they do.
And thank you, and we appreciate what you do.
Coming up, September is National Preparedness Month. A look at why we must pay attention to this message. We'll be right back.